because I've always been involved in the most innovative of ventures, I'm kind of used to getting shot down. It's just like it's like part of the
Well,
part of
let's
whatever.
talk about your controversial background at Signature Pharmacy. How's that?
Yes,
So
yeah.
Signature Pharmacy, you got hired on there as a rep. Tell us a little about what your job was, who you dealt with, and then we'll eventually get into what
Yes,
happened.
yeah. My picture got shot around. It was very very scary time.
Well, what'd you do? What'd you do? Tell us
Well,
what you
Signature. One of my buddies worked for Signature Pharmacy. Kurt Calvert,
did. Okay.
friend of mine. I just got done doing a long bike ride with him, and he got off the bike and said, "Listen, Russ, I want to introduce you to the owners of Signature Pharmacy, Stan Loomis and Naomi Loomis." And I said, "Yeah, that sounds like a plan."
You ready to
So
get out of paramedic stuff? Because
yeah, and I was already
moving on.
I was already out pretty much. I was already consulting with some of the research labs. I had my own nutrition program, so I knew Kurt told me Signature was doing about $5 million a year in women's hormones, and I wanted to plug the nutrition part into the distribution channel.
Okay.
So I met the owners. We hit it off. You know, I got hired as the director of research and development, and we were traveling all over the United States training physicians and doing advanced treatment protocols. I even focused on the women's hormones and developing. We worked on doing blood tests for developing a new long-acting growth hormone.
Oh wow.
Yeah, and the hormone therapy for men was a really hot topic. I knew from my years of endurance training that elevated cortisol and stress shut off all the hormones. So I took that. I actually brought on my nutrition program. I had a room upstairs where my vitamins were being made and being shot out the door through their distribution channel. So it was a win-win all the way around. And then the controversial part came when
Well, the hormones and nutrition, like what kind of hormones and nutritional stuff did you do, and what kind of clients did you have?
yeah, we had the women's hormone replacement program. We would do hormonal testing on women and do bioidentical hormone replacement testing from
Okay.
women. That was Signature's first market.
As opposed to just synthetic junk, you give them bioidentical.
Yeah, they would give them bioidentical. Suzanne Summers' book was real popular. We would travel from LA to Vegas to New York
Okay.
to Chicago with our booth and give them presentations. I would do presentations and help educate the doctors on these advanced testing and treatment protocols. So, it was like we were doing a great business. It was almost like a movie. I mean, it was people were flying in from all over the country to go through training at Signature. It was a definitely exciting time. I was consulting with Major League Baseball teams and doing interviews and
Okay.
putting together a lot of the training programs, and then things went south really bad.
So what happened? Yeah, I think the FBI was involved. Right?
Yeah, the federal a federal agent came from New York City and shut the place down.
Okay.
Arrested everybody on site for distribution of anabolic steroids, and Signature ended up getting cleared, but it was a very scary time. My picture, I did a
Because there's some news articles out there, busted, Signature, hormone,
Yeah.
doping, yada yada yada, and then a list of athletes, and everybody kind of came under fire.
yeah, that and my
And
picture
eventually,
my picture
oh,
got
whoops, we were wrong.
yeah my
right?
picture got shot around the world on CNN for a while, and the local news. So that's who your real friends
Yeah.
are. I mean, I had attorneys say that I can't be your attorney anymore, and I never got accused of anything. I never got talked
Yeah.
to. Nothing happened to me. But I was part of their management
Yeah.
team, and everybody in the management team got arrested. So I understand. But when you go through something like that, you know who your friends are. And my specialty was performance enhancement. And I work with high-level athletes, cyclists. I totally get it.
Yeah.
I understand, and one of the things that we were doing, growth hormone can run people $40,000 a year. We were importing the growth hormone from China. I don't know if that was even legal at the time, but we were getting people on programs. A growth hormone deficiency in adults got approved in 1996 to use growth hormone on adults, and I was training physicians on how to use it effectively. And because a lot of celebrities and professional athletes were using our product, when they shut us down, it was like, I mean, we were judged immediately.
Well, you guys were on the cutting edge of stuff that you did too. 'cause a
Yeah,
lot of your-
nobody knows the whole story. It's obviously, performance enhancement, and they don't know that the football players right now with head trauma, there's troops coming back from Iraq, are going to need testosterone and growth hormone to rehab their brain, to grow new brain tissue, synaptogenesis, neurogenesis. But you don't hear about that. Look at the movie Concussion that just came out.
Yeah.
Let me ask you a question. Why isn't the military talking to the NFL? And why aren't they designing programs for the troops coming back with post-traumatic stress or chemical dependency. You know, why aren't we using the testosterone and growth hormone therapy, right? Because it'll help rehab their body. You know, you can't just give them Prozac and Xanax.
Yeah.
You know, and again, you know, maybe I get a little frustrated because I was one of the guys that was first through the door. It seems like whether you're the first through the door, you're the last one to get taken care of, whether you're a cop, fireman, war veteran. You know, and then when I work with a lot of the professional baseball players, I mean, when you see what these guys go through, you know, whether it's, you know, a professional athlete or Lance Armstrong, you have a respect, you know, for these guys. They
go through a lot.
They are the one percenters.
Yeah.
I mean, there's a lot of similarities between, you know, special forces guys and professional athletes. I'm just saying.
People see it easy. It's easy to criticize them on TV and say, I
Yeah.
can do that, this and that. But they definitely train. There's a lot you see when the cameras are not on them.
Exactly. And, you know, there's a bunch of guys sitting around a table at Starbucks and they're spandex overweight talking about cyclists using performance-enhancing drugs and they have no clue. You know what I'm saying? It's just, it's crazy.
Well, we'll
know,
talk a little bit about that when we get into our testosterone area. That'd be a good thing to hit up there. But let's talk about addiction stuff now, because that was your signature. Bam, cleared, got out of that, learned a lot, built some business up, some reputation, did a lot of testing, and you were able to keep the information that you tested, and you kind of learned from that stuff.
Yeah, I think when I was with Signature, even after the arrest, the people that knew me knew that, you know, they knew the big story, and Signature ended up getting cleared. But being out on the tip of the spear with Signature, like I was in the days of being a paramedic on the street, it allowed me to travel to all the major cities, interview and talk to the doctors, listen to the patients. I went to anti-aging centers where I watched 60, 70, and 80-year-old people on the hormone replacement therapy, using the growth hormone, watching their bodies resonate. Now remember, I used to take people to nursing homes when I was a paramedic, and I'm like, why is this guy going into a nursing home at 60 and another guy's still on the golf course? Well, now I got to look at all those labs. So by me immersing myself in performance enhancement and then the elderly market and then dealing with AIDS patients and muscle wasting patients in the elderly, that's called sarcopenia. So I've dealt with all these people, and I started pulling puzzle pieces together like I was back on the emergency scene, except now I wasn't in such a traumatic environment, and I really got to work with some really savvy folks. And I just started to see things like, wow, we can make a difference in brain chemistry. We can make a difference in addiction.
Let's talk about addictions.
Addictions, okay.
Because everybody in this society seems to be addicted to something, whether it be like social media, drugs, medicine, adrenaline junkies.
That was me, yeah.
You know, all of that. But so what do you see happening? We all understand addictions, but let's see, what do you see happening on a cellular level when it comes to addictions?
Well, yeah, and believe me, I've worked with a lot of addicts, alcohol, food, opiate, heroin. I help heroin addicts, you know, get off that drug is just evil. It elevates your dopamine levels 800%. You know, which is like, it's when they say you could be
more
addicted,
so than anything, yeah.
Exactly. It's the one elevation. You know, they got alcohol and oxycodone and heroin, and when you inject heroin, it's very easy to understand how it can be. You could get addicted to it one time. Okay, so what's being said? I've had executive clients that I've worked with we get them on the wellness program, and then I stay with them a while, and I find out they have some kind of addiction, whether it's alcohol or whatever. So, you know, I know talk therapy is going to be one piece of the puzzle. You know, I know that, you know, the 12-step program only has a 25%, you know, success rate. So, you know, I went to these addiction centers. I interviewed the doctors. I, you know, put together testing at my lab and developed programs that aren't being done in the addiction market. And I'm consulting with addiction centers right now. So all I did was basically, you know, look at what the best centers on the planet were doing. And I said, okay, why aren't they looking at this, this, and this? They should be in order to rehab somebody.
So what are they not doing right? What are they?
Well, I mean, you know, you cannot treat somebody like, let me give you an example. Alcoholics Anonymous. Well, if you go into any meeting, it's full of, you know, Hershey bars, candy, caffeine. So I mean, and all alcohol is a super carbohydrate.
Yeah.
So here
Just
they
the
are.
sugar.
They're not drinking, getting their chips, but they're banging down the carbs, elevating their serotonin levels, while they're actually in the Alcoholics Anonymous meeting. What I developed with my team is that every women and men have to be treated differently. Okay, addictions are multifactorial.
Okay. Makes sense.
Yeah, I mean, if we're all biochemically unique, then how's one addiction program going to work for all of us? And I developed an addiction aftercare program where I'm interviewing right now with a couple of detox centers that help people transition in that period of time. Well, in order to turn somebody's brain around from an addiction, you're looking at about a 3-year process. We have to rehab multiple systems of the body. And you think about it, you come off of heroin, where do you go? You go to Suboxone, which is another opiate, or you go through an assistance program where you're on methadone.
Yeah.
I've met people that are on methadone for 10 years. I mean, what?
Well, it's
they're
a
still-
money-making business.
Yeah, it's a
what it
business.
is.
It's
Yeah.
follow the money. Follow the money. But if luckily I'm with some very brilliant folks. I've interviewed neurologists, and I've had people sit down with me. My buddy, Dr. Stanley, owns an MRI center. These guys are always a phone call away, and I'm so blessed to have this crew of people that just make things happen, because it's I don't want to. Obviously, I can't save the world. I need a team, but to develop these new treatment protocols for addicts, I mean, we could definitely do it better.
So you do your own interventions. What do you do that's a little bit different?
Well, I mean,
Without giving away your secrets, tell us.
No,
something.
no. It's okay. We just look at different metabolic markers. I mean, we look at. I mean,
Okay, so what does that mean?
We look at nutritional and hormonal deficiencies.
Okay.
We look at how the environment. There's a lot of environmental toxins out there that physicians don't consider that could compromise somebody's body. Even an addict, even what you rub on your skin, if it's a chemical, can affect people that are going through addictions.
Lotion, soap, all that kind of stuff.
It causes toxins.
Okay.
So physiologically, we just bring a bigger toolkit to the addiction
So you
table.
look at all those aspects.
Yeah, and then we plug in a treatment protocol, and you also need talk therapy.
Which balances them out.
Exactly. When you do drugs for a long period of time, you do alcohol for a long period of time, or you compromise multiple systems of your body.
Yeah.
You're not going to get well unless we treat all those systems at the same time.
Gotcha. And most of the addiction centers are just looking at one part.
Yeah, they're looking at they're treating
brain,
something in
or
isolation.
Just detoxing, and that's it.
Well, think about this. We weren't able to look inside the brain with fMRIs only up to a few years ago.
Yeah.
Now we can actually look inside the brain and watch the addiction. Let me give you something.
And the cells actually firing up.
This is pretty neat. You could Google this. This is called Mouse Park. They would give mice heroin and water, and a mouse would come into the cage and start going after the heroin, and they would study that, the scientists. Well, number one, think about a mouse being in a cage, totally not his environment.
Yeah.
But this is what they did. They put the heroin and the water in the same cage, but then they put a mouse park. They had the mouse interact with other mice. They gave him things to do inside the cage, and all of a sudden he didn't go after the heroin as much as he did.
Really?
So maybe the mouse, like myself and the rest of us, can't deal with dead air.
Yeah.
So now,
So it's that time when you're sitting at home,
yeah,
that off time.
The off time.
What do I do?
yeah, hey, let me come back into work. I need to come run emergency calls, because
The dead air.
I'd be running emergency calls. Those lights would be going. I'd be smoking a cigarette, inhale it as deep as I can, put my headset on. Nicotine is
Definitely
nicotine is a stimulant and a relaxant at the same time. And I remember smoking on the way to rescue calls, running the scenarios in my head. We got an auto accident, 5 people down. I'm thinking, okay, I gotta land a helicopter. I've got to start 2 IVs. They're giving me a picture of the scene. I'm running these things in my head, smoking the cigarette. I get out on the scene. I put my headset on. I start to call the hospital, and I am jacked in.
Yeah.
And try to wind down from that.
Yeah. So you understand why people you work with, musicians on stage, performers, athletes, what do they do when they sit around their big houses all by themselves?
Well, one of my
That's where
best
they get in trouble, right?
Yeah, one of my best friends, and you know him, Eric Pace. He's a singer-songwriter for the God Amsterdams. We always brainstorm on ideas, and we develop content like this book I did. Content is a new oil. So when I brainstorm with Eric, he's able to. If you knew what went into writing a song, mastering a song, he really educated me, and I love him because he's a wordsmith. He and I brainstorm on how to educate people. A lot of my medical content, I kind of watch how he wants to develop a song, or write a song, and how he condenses and gets people to think about certain words.
Yeah.
Okay, words light up our brain chemistry. So I always run my content by him. So you're right, singers, songwriters, athletes, war veterans, the dead air, they can't deal with that dead air. That's when they get into trouble with the drugs, the alcohol, the women. They're looking for something. And like what I was doing, I was drinking a lot back then, and I wanted to go back into work and keep working. And that, you know, that's not healthy. And I was saying, oh, I was saving lives trying to justify it, but I didn't want to go talk to anybody either, Trent, because I didn't want that on my record. I want to get promoted up the ranks. I'm not going to say I had to go see a psychologist or a psychiatrist. I didn't want to go see them anyway because, you know, they just treat the brain, you know, and you know, it's been a tough ride, but I'm still just as enthused today as I was back then.
Before we leave the addiction topic here, tell us about testosterone. What role does that play with addiction? Because testosterone is a hot topic, and people just think of testosterone as, oh my gosh, my libido, my sex drive, but it plays a bigger role inside the human body. But what kind of role can that play with addiction?
Well, yeah, that's a great question. Testosterone, you know, testosterone is going to play a big role. That's one of my expertise is on testosterone therapy, hormone replacement therapy in men and women. And a lot of doctors, even here in Orlando and in Florida, just treat testosterone in isolation.
But you can't. You
can't.
Estrogen too.
Yeah, I mean, I work with all the bodybuilders. I know what these therapies do. I mean, this is a book here just on the anabolics, over 500 pages of anabolics and what they do and who uses them. This stuff is not going away, but here's what I'm worried about. A lot of guys will go online and buy their own testosterone and start injecting it without any blood work. And listen, I get the fact that medicine is moving slow and medicine is broken, but if you guys are going to take care of yourself, you got to do it the right way. So you can't just treat testosterone in isolation. Like I talked to a doctor the other day, he's putting testosterone pellets in people. Well, if you put testosterone pellets in people, how can you control the dosing? If your testicles release 8 to 10 milligrams a day, and then you're under some type of stress and a doctor inserts pellets in you, how do you control the dosing? So, you know, I didn't say anything. I'm just like, okay, that.
Icon intimidation, the guy in the lab coat.
Yeah, the guy in the lab coat. So here's the deal with addictions. Any type of addiction. Yeah. The hormonal replacement therapy has to play a role in rehabbing the brain.
Okay.
The troops coming back from Iraq, I mean, you know, or coming back from any war zone, their levels are all in the toilet.
Rehab the brain.
We need to rehab the brain, and testosterone is going to play a big part of that. How testosterone got to be a level...
So vilified.
I'm just so vilified. It's because, you know, I was right in the middle of that with the signature arrest. I mean...
Performance,
Yeah, performance enhancement. Well, dude, you know, what do you think an 80-year-old guy's going to need to stay in the game, or woman? They're going to need hormones. They're going to need performance enhancement. They got everybody talking about, oh, osteoporosis. No, it's about muscle mass. Yeah. You keep muscle mass on somebody, they'll keep strong bones.
Yeah, like strong muscles, you won't break.
When my mother and father were alive, they were on the hormone therapy, and they were in their 80s, and we were keeping them in the game. Now, they had to go see my doctor and 4 other doctors. I said, even me, with everybody I know, when I was putting treatment protocols together for my folks, it was like I had to go to 3 different doctors just to keep them healthy. I'm like, what a bitch, really? Yeah. Why can't we just have one
person to do it all?
You know, one person. And luckily, the doctors that work with me, they are truly that 5% that get things done. Yeah. You know,
they get it. You need those. Yeah.
I do need them. I mean, we have to work as a team.